You're watching this video if you or your family member is being treated in a hospital for suspected COVID-19 infection. As you know, COVID is a new disease and there are no proven treatments to beat it yet. We need to gather as much reliable evidence as we can through research and clinical trials. Research is pivotal to the government's strategy to fight COVID. We're inviting you or your family member to join us in this fight against COVID by being a participant in one of our national priority studies. This video will give you a brief idea about some of our intervention studies. At present, there's no proven treatment for COVID-19, but there is some early evidence that certain licensed medications used for other diseases could help improve outcomes in COVID patients. So now, these medications are being tested in COVID patients as part of these intervention trials, in addition to standard supportive treatment that all of our patients get. Patients can choose if they want to be part of these studies to get these added medications that could help in recovering from COVID. If patients decide to join any of these studies, they will be randomly, just by chance, allocated to get one of the study drugs, or some patients will continue on the standard of normal care on its own. These trials have so-called adaptive designs, which means that drugs that are not working would be removed and other drugs that look hopeful could be added. Some studies may collect additional blood samples to analyse the effects of those added medications better. Patients taking part in these studies will be consented for their health records to be collected. Please note that all personal information will be removed. Each study will have its own special arrangements for data collection and for storage. And please refer to each study's participant information sheet. If you agree to be part of our studies, someone from the research team will contact you. If patients are too sick to decide for themselves, a nominated professional consultee who's not related to the study may decide on their behalf. In these circumstances, we will try to contact their next of kin to receive consent. It's also possible that you've received this video because you've already been enrolled into one of our research studies. This might have happened when you were too poorly to consent yourself. For instance, you may have been on a ventilator or receiving other treatment. We are contacting you now at our earliest possible opportunity to explain why this has happened and to ask for your continued consent. An independent research ethics committee has approved each of these studies. Should you have questions about any of these studies, please speak to someone in your care team. If you agree to be part of the above studies, someone will contact you. If you decide not to join any of these studies, it will have no impact on the care that you or your patient or relative receives. Thank you from the research team at Barts Health NHS Trust, and thank you for supporting the NHS and research in these difficult times.